All right, our next presenter is Kirk Furlotte, who's joining us from Halifax. So Kirk has a Master of Arts in Health Promotion. He is a Master of Arts Health Promotion student at Dalhousie University, where he also received his BSc in Health Promotion. His honors thesis looked at young men's help-seeking behaviors in relation to sexual health. Kirk also currently works on a national research project looking at end-of-life preparations for older LGBT adults. He's active in a number of LGBTQ organizations in Halifax, including the Nova Scotia Rainbow Action Project, an advocacy and education organization, the Advisory Board for Pride Health, a municipal health service outreach program for LGBTQ communities, and the AIDS Coalition of Nova Scotia. So please join me in welcoming Kirk.
Thank you. Thank you very much, everyone. So as Travis mentioned, there was a co-presenter originally, my friend Chris Aucoin, who is really the brainchild, this is his baby. This is his campaign, but unfortunately couldn't be here today. I was on the advisory committee for this project, and I suggested that we present it, and he was like, that's a great idea, let's go to BC, and then he couldn't. So, a little bit about us. The Check Me Out campaign, which is what I'm presenting on today, was developed and administered by the Gay Men's Health Project, which again is really just Chris Aucoin for the AIDS Coalition of Nova Scotia, and in partnership with a whole bunch of people, several of which I'm involved with, which is how I got so heavily involved in this project. We also were endorsed by some other local agencies, including the Prostate Cancer Canada, Hepatitis Outreach, and we got funding from a number of sources, including in-kind donations for some of our things like media buys and photography. And one of the things we forgot to put in here, which was, the very different nature of Halifax. Like, I love Halifax. I've lived there most of my life, but I've also lived in Calgary and I've lived in Vancouver, and I just did some double checking this morning. So the greater Vancouver area has a population of approximately 2,400,000 people. The greater Halifax area has a population of 400,000 people. So there's a bit of a different dynamic. So our original plan was not to address health literacy. Our original goal was to encourage and normalize regular HIV and STI testing for gay men, bi-curious men, bisexual men, men who have sex with men, as part of treatment as prevention, which was mentioned earlier. So in practice, that usually means discussing sexual health with your healthcare provider. But local research and anecdotal evidence told us that most gay men were not talking to their doctors about their sexual health, even those who were out to their physician, which is a bit of an odd issue. How do you deal with that? So the big issue was people didn't know what to talk about. I mean, we're talking about the health literacy, and they just didn't know what questions to ask. They didn't know what issues to raise. So that's where this campaign came from. So the new goal was to encourage and normalize regular testing, and to promote informed dialogue about sexual health between men and their family physicians. And we did focus specifically on that dyad, men and their family doctors. So a little bit of background. It was developed for over a year with several community partners, including myself, and in consultation as well with 2 family physicians to sort of get their feedback, because as you'll see in a moment, we targeted gay and bisexual men, but also family physicians. So we wanted their feedback as well. And it was informed by relatively new research about HIV infection regarding gay and bisexual men. And the campaign was inspired by a campaign out of London called Count Me In, but we just slightly revised it, called Check Me Out. And it was launched at Halifax Pride in July of 2013. So, again, this is the lack of social supports and comfort for men in talking about sexual health with their doctors and other healthcare providers. I think somebody in the last session was talking about how people would go past their closest clinic to their house to get further away so that they had that sort of anonymity, which is something we saw. Other research providing new information regarding continuing HIV infection patterns with gay and bisexual men and related intersection issues, presence of other STIs increasing HIV transmission risk, and the role of newly infected and undiagnosed and untreated men being the prime source of other new infections. Simultaneously, Halifax was and still continues, as many cities in Canada do, have a syphilis outbreak, a rather significant syphilis outbreak. So our challenge, if we're going to convince guys to have meaningful discussions with their men, that would also lead to getting the tests that we're hoping that they would get, at least one of those 2 people, either the doctor or the patient, needs to know what they have to talk about. So our first strategy was the men's checklist. It's a cheat sheet, basically, like a quick little, keep it brief, because, let's be honest, attention spans aren't what they once were. If you don't get to them right away, they're not going to pay attention. So it's a quick checklist, including details on why we recommend these things, because, you know, the whole like, well, why should I get regular STI testing? We added information on other sexual health recommendations, including, you know, if you're in your 20s, maybe you should you should learn how to do a testicular self-exam. If you're in your 40s, maybe you should be getting prostate exams. And we provided options to where they could get tests done, because this was focused in Halifax. The original guide was focused specifically on local resources, but we did make slight variations to take to other parts of the province. And we provided much more information on the campaign website if guys wanted more in-depth information. And then the second strategy was the physician's checklist, which was an expanded checklist for family physicians and others to use as a reference, because again, I'm sure most of us here are not surprised that doctors are not experts on the needs of gay and bisexual men. So again, same thing, we included other sexual health recommendations that, you know, doctors know but probably don't think to ask. And we added introductory recommendations regarding other intersecting health issues of significance to gay and bisexual men and their health. So for example, you know, as I sometimes call it, the sad list of things afflicting gay men, you know, like higher rates of alcohol and drug abuse, higher rates of violence, that sort of thing. And again, additional campaign detail on our website. And then design. Chris Aucoin, who again created this campaign, is a design genius, so he put a lot of thought into how this would work. So the order and design of the men's checklist is aimed to allow men to engage and consume as much information as their interest, oh, that's a typo, as their interest and capacity allowed. It is also to allow physical copies, of which I have several here if you want one, to be folded to the size of a business card so that you can transport it fairly easily. And the design of the physician's checklist, because it was a little more extensive, wasn't quite as brief. But so, for the men's checklist, again, folds out to the size of a business card. The cover is what they see when they're folded, so it just says, my annual checklist for sexual health. And then when you open it up, down here is the basic recommendations, which is HIV and STI testing, and gonorrhea and chlamydia, and then what they are. So for example, HIV, syphilis, and hepatitis B and C are blood tests, whereas gonorrhea and chlamydia are urine tests. It also has our website, QR code for those of you who have with smartphones. And then on the back, our top 4 recommendations, which are when you have an STI, things you don't know. When you have an STI, you may not have symptoms. They won't go away on their own, FYI. Some STIs can lead to serious, even life-threatening health issues, even when you don't have symptoms. And having any other STI increases your risk of HIV transmission, either getting or giving, by up to 400%, depending on what you get. And then the big, long section, if you've made it that far, includes things like what vaccinations are recommended for, in Nova Scotia, of course, Hep A and B are covered by the province for sexually active men who have sex with men. Things like, again, this is the age. Look, so, you know, men over 21, testicular self-exams, men over 40, talk to your doctor about early detection of prostate cancer, where to get HIV and STI testing. And then for the doctors, again, it's slightly larger, basically the same content, but expanded a little bit more and slightly more medicalized language so that, you know, they would appreciate it. But again, kept very briefly because, you know, is anyone in the room a doctor, a medical doctor? Yeah. How much free time do you have? You don't. It's like, here, look at this right now, move on to the next thing. So we kept it very brief, but again, the website had more information available for download. So our strategies for promoting it, in-person promotions, the campaign was launched in July at Halifax Pride. We had campaign shirt-clad volunteers handing out checklists, buttons, and temporary tattoos if anyone wants one. I've got some of these as well. And any women who showed interest in the campaign were asked, like, here, pass it along to a friend. And we've also had events at bar nights, and we've taken it to other Pride events in the province. Printed and electronic promotions. The promotion of the campaign was given as much consideration as the content, because if no one's reading it, well then, not much point. So we used 8 diverse, local, out-known gay men as campaign ambassadors for the visuals, and the posters and ads featured the men were tongue-in-cheek faux personal ads, and the core message was, I get checked out, will you? And so here are some of our lovely spokesmen, ambassadors. So this is Willem, he works with Halifax Pride. This is a local DJ. This is Justin, he used to work with a university group. This is one of our more famous drag queens. This is my friend Simone Thibault, who is a blogger and a reporter. Kevin Kindred is So, as someone today said, it's like every time something gay comes up, Kevin has to be there. This is Robert Wright, who is a social worker, and this is Al McNutt, who works with an AIDS organization in the province. The posters were placed in the usual gay and gay-friendly locations. Print ads were run on local transit buses, which I have to say, you know, it's a small city. I was like, I think this is the first like explicitly gay ad I've seen in like 10 years. We had them in the local free weekly, which is The Coast, as well as in Doctors Nova Scotia's monthly newsletter, because again, targeting both. And we also shared them via social media. But the majority of our ad budget went to online and mobile app ads in Waves, Squirt, and Grindr. And that is actually where we get most of our hits. So here are some of the ads. So this one up at the top is the bus ad. These are some of our posters. Like this is just Willem, and I think we use him a lot because he just have you can like the whole campaign was supposed to be fun, and he's got the greatest smile. And there's one with all of our guys, and then this smaller one down here is the app ad because you know it has to be really tiny to fit on an iPhone. So the results: over 1,700 men. Over 1,700 men's checklists were printed and downloaded altogether, and for the doctors, it was over 109. And then we did an online follow-up survey, which we promoted through the same ads. So we bought ads based on Grindr. We had all our community partners promote it. And over 300 evaluation surveys were completed, which for us was quite good. And the surveys indicated that the campaign was liked, appreciated, and most importantly noticed by 66% of the survey respondents. And of those 66, 67 reported one or more of HIV and STI testing, 22% plus 17% thinking about it, and or conversations with their family doctor regarding sexual health issues, which is of course a big issue for us, and increased sexual health knowledge. And the other few stats that I wanted to mention were that 52% of the people who said that they recognized the campaign discussed it with friends, family, coworkers, that sort of thing. And 87% said it was appealing or very appealing. And a lot of that was because of our use of local people. You know, and that was one of our whole points was that you would recognize these people. This isn't just some photo stock character. These are people you see out and about at events. And for me, the two biggest ones that I got, quotes that I really like, is someone took their friend to the Halifax Sexual Health Center to get their first STI test ever because of the campaign. And then there was a couple who saw the campaign, and they both got tested, and they found out one of them had syphilis, which obviously is not good, but better that they find out now. So, learnings and gaps. The feedback regarding both content and promotion was very positive. The significance of online social media as a location for doing and promoting health promotion work was pretty significant. So again, Greater Halifax is 400,000, urban Halifax is 300,000 people, and Grindr has 14,000 users listed as being in Halifax. We're a university town, I'm not entirely surprised. As always, getting the adequate resources was one of our greatest challenges. You know, again, small province, a small organization. Chris, who I love very dearly, he's only part-time employed, and he's basically worked on this for a year. That's part of the reason it took a year. Our campaign website, which was going to be a big, we were going to revise it and like make it all fancy and new. We ran out of funding, and we just didn't get to do all those revisions, so it's never quite looked the way we'd like it to. And next, well, we're currently in the last active phase of Check Me Out, which is targeting university-aged men, because again, Halifax, if you've never been, is very much a university town. There are 5 universities in Halifax, so yeah. So we've got a lot of people coming in from away. We've also had expressions of interest from other AIDS service organizations about possibly adopting and adapting the campaign. I can't tell you which ones. Chris would know that, and. We are using the campaign as a template to develop a similar checklist tool and campaign for transgender individuals in Nova Scotia relating to their sexual health. And I should point out that, as I said, this is the last active phase of the campaign, but all the content still stays up. We still have tons of material printed that we can distribute at events, and we're hoping that more guys will get checked out. And that's it. Thank you very much.